Rekha has just heard her yet unnamed 15-day-old daughter has died. Her mother-in-law, Anarbai, is holding back her tears to console the young mother. The child was finding it hard to breathe when they brought her to the hospital.
The doctors didn't say anything. They took her blood and everything, but only the doctors know what happened.
Since December, more than 100 babies have died here at this public hospital in Kota, in India's northern state of Rajasthan. A government watchdog says at least half of the life-supporting machines, like ventilators, were not working. And pigs were roaming around the grounds. It says conditions were unhygienic. Many of the infants died because of septicemia, a blood poisoning that's often caused by bacteria, and of pneumonia, an infection made worse by the cold weather. And yet, the protective glass panes on several windows in the wards were missing. Padma lost her 5-month-old son Tejas to pneumonia. She says he was sleeping in front of an open window and succumbed to ice-cold winds.
There was no heater, all the windows were broken, and the window in front of the bed with my child too. Doors were also open day and night.
And suddenly, over a dozen women had descended on the hospital with brooms. Some windows were being fixed too. Over the last few days, as news of the deaths emerged, the state government ordered a quick cleaning of the hospital. Earlier on Friday, we witnessed a truck full of garbage leaving the premises and painters refurbishing the walls. And still, many parts of the hospital are not clean, and parents complain of dysfunctional life-sustaining equipment. Perhaps the measures were all to please the state's health minister. He was visiting the hospital for an inspection. His government says the number of infant deaths at the hospital has come down over the last few years.
Ventilators and all the machines are working? No, I'm not saying that. But those are not working, will be working in a couple of days. We have ensured it.
But this is not the first time, or the first hospital, or the first state where babies have died in large numbers. The Indian government spends a little more than 1% of its GDP on healthcare, but experts here say it needs to spend a lot more to ensure its youngest citizens get a chance at life. Anchal, Vohra, Al Jazeera, Kota, Rajasthan, India.